I will be discussing about the differences of health conditions among cultures and genders in the Latino community. The information in this video is for informational purpose only and was produced for a class project. The creator is not a medical professional. The student, faculty, and university do not guarantee the accuracy nor reliability of the content, nor should it be a substitute for professional medical advice, diagnosis, or treatment. If you have a question about a possible medical condition, please contact your physician or qualified health provider. Never delay seeking treatment, nor disregard the advice of medical professional due to information you receive in this video. So, to begin with, based on cultures and genders, the risk of having health conditions vary drastically. Within the Latino community, there are many who are immigrants which can affect the probability of risk of diseases based on the gender and socioeconomic status. So, what this will be discussing about is the common health conditions, how they differ between youth and adults, your socioeconomic status, what policies take place, and how did that affect you. One of the resources that I found stated that Latino children represent the tip of emergent health disparities in the Latino population that will be largely determined by the differential environmental exposures and the intergeneration social stratification patterns in the U.S. society. And I will also be discussing about what actions programs can help reduce this risk and help families. So to end this, in regards to health, each condition can differ with age, gender, and cultures. The key factors in order to maintain a good lifestyle is being educated on the subject and taking action. Our lifestyle is affected by many factors like socioeconomic status, gender, and cultures due to beliefs or religion. Society and parents are important role models for children to maintain healthy lifestyle behaviors, which these habits can continue through their lifespan. Have a great day, everybody.